Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. I'm very pleased today. My guest is Carter Groome. Carter is the CEO of First Health Advisory. First Health is a global risk management and digital transformation advisory firm really focused on the assurance, security, privacy, technology, and efficiency needs of healthcare. Carter, welcome to the Tate Chronicles.
Well, Jim, thank you so much for having me. I'm honored to be on the Tate Chronicles and appreciate the topic of the day.
Exactly. And the topic of the day really is, we're going to be talking about the state of cybersecurity in healthcare. I know that First Health Advisory is a lead sponsor for the upcoming Chime online event titled The State of Cybersecurity in Healthcare. It's a virtual summit, February the 8th. And Carter, the discussion you're leading was kind of fascinating to me. It's We the People Seek Cyber Health Initiatives Call to Action. So I know we've seen, that's a good place to start. We've seen incentives for healthcare technology adoption and now for the use of that certified technology. But this really is the first time I've heard of potential incentives based on cybersecurity practices. What can you tell us about this? Who's behind this? This is all new to me.
Yeah. A lot of us in the field are familiar with meaningful use and what its role was and what it's done for the industry. But when you think about cybersecurity and you think about the posture in general, the hygiene of healthcare providers and overall care providers in the United States, we are woefully deficient in terms of our resilience and preparedness for attacks. And you've seen it in the news. It feels like Groundhog Day every day, every week, every year, in terms of well-known large health systems being attacked all the way down to critical access, small and rural hospitals being attacked. And so these ideas around incentives have been kind of percolating in Washington for some time, pre-pandemic with AMA and Chime and HIMSS and some other associations talking about these ideas. There have been studies, about patient outcome impacts of ransomware, more specifically, the diversion of care that results from ransomware or supply chain attacks that have started to really raise awareness beyond our little bubble of security practitioners in this field, to Congress, to Senate, to executive members, and they recognize something needs to be done. There's a group called the Healthcare Sector Coordinating Council that works with and advises Health and Human Services, which is a sector risk management agency that have been putting out ideas as well. And we're trying to kind of harmonize, that's the buzzy word in town, harmonize how we get after some type of baseline or some type of, bottom, hygiene to move the needle here, and getting the executive branch on board as well as the legislative branch is really important in this initiative. And because I'm here, Jim, in DC, and we advise nearly 1/6 of the nation's care providers on cyber matters, I've been doing all I can to amplify that message. It really got a boost from Senator Warner and his staff when they submitted a paper, kind of a request for information, an RFI, in November of last year, a paper called Cybersecurity is Patient Safety. And they hit the nail on the head with that. And it covered a smorgasbord of issues, related to cyber, related to privacy, related to preparedness or our lack thereof. That included incentives, it included workforce challenges, how we modernize HIPAA, if there should be, something done at a national cyber level. And that paper was really a milestone, Jim, in giving legitimacy to the idea that incentives or motivation to act could be a viable path to improving critical infrastructure and the resilience of the healthcare ecosystem. So there's real movement here, and I'm proud to be a part of that because it's definitely needed.
Over the last few years, as I guess it was the meaningful use incentive program that really stimulated and increased the percentage of providers that were using electronic health records. And so as part of that incentive package, everybody, whether it was a single provider or a large hospital system, had to attest that they had done a security risk analysis. Now, what was acceptable as a security risk analysis varied extremely widely. Certainly, very frequently was not considered, a true risk analysis. It was just more or less checking a box. And so, best practices. How will those best practices, whether I know it's going to be very different from a large healthcare system to a provider practice with two or three providers, but how are those practices going to be defined? How's this going to be determined?
Yeah, that's one of the $1 million questions, or even more dollars associated with that question. And some of us are calling it the baseline. Some call it minimum viable security practices, but we have to come to consensus, on what those practices are in technologies, the tools associated with that, the policies associated with it, et cetera. And there's been a lot of great work that's been done in this area, from 405D in that program, the Health Sector Coordinating Council that I've mentioned, that have come out with guidance. There's newer guidance around the NIST cybersecurity framework that's going to come out that's specific to healthcare. CISA has gotten involved, and of course HHS, as a sector risk management agency, is starting to try and figure out, well, what is that baseline? And so I'll go back to that word harmonization that's being thrown around. What we need to do, number one, is figure out how all these different agencies and stakeholders can come together and agree on what that is, because everyone has a little bit of a different flavor of what is going to reduce the most risk in this sector. If you're talking to a medical device manufacturer, if you're talking to a security platform vendor, if you're talking to a government policy, expert, you're talking to a HIPAA security or privacy, everyone's going to have a little bit of a different view of what that baseline should be. But it's my belief that whatever it ends up being, it's got to be effective, and it's got to not create undue burden on the providers that are ultimately seeking these incentives, whether they're a critical access hospital, small rural facility, all the way up to the largest health systems in the world. So we've got to strike that balance, and that's a real challenge. But it's being discussed, and I think if there is energy behind the incentives that we're talking about, there will be people will be at the ready to help figure out what that baseline is.
When we talk about cybersecurity, in the way that we're talking about it now, Carter, are we talking about protection from bad actors, or are we also including things about having good backups and redundancy of technology, things like that?
Yeah, all of the above.
Okay.
Right. So bad actors, nation state actors that are trying to just harvest information from the United States and hold on to it, all the way to just being resilient, as a healthcare provider, right? The concern is moving from, the I guess the exfiltration of PHI, right, in data, which, that's still effective to lock that up and get a ransom. But the bigger concern now, Jim, is around patient safety, right? Do you feel safe going into your healthcare provider or that health system, knowing that, the devices that you're going to be connected to, the actual assets that are running that health system and so dependent on technology are going to be operational? Because if they're not, and there's been a lot of studies out there now, well, not a lot, there's been some good studies out there that are saying when these systems are not available to provide care because that health system or that provider has been hit by ransomware, that diversion of care or the unavailability is impacting patient outcomes. I mean, they're having serious impacts to patient, what I call morbidity, right? If your care is delayed, if you have a cancer treatment and it's delayed by a month, what impact does that have on the outcome of health? And so it's a very real and tangible impact that it's having. And that's where I think when we talked about the Warner paper, it's rightly focused on patient safety because it's exposed right now.
Well, let's talk a little bit more about the bad actor domain. So, a ransomware attack makes sense. We're going to lock up your database unless you send me some Bitcoins, essentially.
Yeah.
And so I know they say the first thing you should do if that happens, probably, I believe, is contact the FBI. And what kind of advice or is it just case by case as to what a large health system should do if they're attacked and their data is locked up?
Yeah, that's everybody kind of has a different posture right now. Certainly, contacting the FBI is important, and I would say even before that, building a relationship with your local FBI office. So when you get attacked, the first time you're calling them that's not the first time you're calling them. But we implore organizations, in terms of one of the first, what I call best practices to do is think about your disaster recovery planning, think about your incident response and how you're going to respond to that. And it's not just the IT department and the security department, it's your entire health system. And so clinicians, how are they going to respond if they're going to downtime procedures? How are operations going to respond if the devices are not available? How is the executive team going to respond? How are you going to communicate that out to the community and your patients? So you need to practice that in advance, of that happening, because it's a very real possibility that it is. And if your organization thinks, well, we're doing all the right things, there's no way it's going to happen to us, I think that's a really precarious position to put your organization in. You have to assume that something's going to happen. And if it doesn't, that's great. But yeah, there's all kinds of challenges right now with ransomware, breaches, supply chain attacks. And it may not be because of the things that you're doing. It might be because of a vendor has been breached that you actually are paying the price. And so when we think about third-party risk, that's a huge, huge issue in the healthcare industry right now.
Well, we have seen that. I don't know if I'm not aware of it in the healthcare sector, but and I believe in some of the industrial sectors who maybe are relying on third-party software, somebody hacks the third-party software, and then when the upgrade occurs, it automatically infiltrates, the target. We talked a little bit about ransomware, but for somebody to come in and actually take data, what do they want? What are they looking for if they take data? I know they don't care if I have diabetes. Is it identity theft, getting social security numbers, things like that?
Yeah, I mean, I think that's still an element,
Mm-hmm.
Jim, that's out there. I don't think, where we were a couple years ago, it's as important to the malicious actors out there to take that data necessarily for ransom. It's not, $1,000 per record that you hear, but
Yeah,
I can't believe when you go onto the dark web, or the black market, that you're going to buy patient records for more than a couple cents, right? So
right.
it's not that; it's just the act of locking up the availability of information that is going to precipitate getting paid because you can't provide care. So it goes back to the patient safety issue, but also the ability to deliver care that is compelling these ransom payments. But there's still this element of harvesting data,
Mm-hmm.
even if it's encrypted, to harvest it, because if you look forward to what I believe quantum computing is going to almost negate encryption as we know it today, some countries or organizations that are malicious are harvesting that data in the event that in the future they'll be able to de-encrypt it and start to use it against us for many different reasons that don't necessarily include monetary gain, right? And so there's so many different reasons why the data is still important. Uh,
Mm-hmm.
but I think just right now, being able to lock it up so that there's no availability of that data is not allowing those health systems to provide care, and that's where the real, I think the real risk is.
Um, to our audience, if you're just joining this episode, I'm Jim Tate. And on this episode of the Tate Chronicles, I'm speaking with Carter Groome of First Health Advisory. And the topic is cybersecurity. Carter, tell me a little bit about First Health. Who are your clients? Are they health systems, insurance companies? Who do you work with?
Yeah, we are 100% focused on healthcare entities,
Mm-hmm.
and a big portion of that is your more traditional integrated delivery networks, your health delivery organizations, all the way from sort of critical access, small and rural hospitals, which in the cyber community we call them the have-nots, right? They don't have the expertise, the resources, the dollars to really even do anything about security, privacy, and enterprise risk. So we serve that sector all the way up to the largest health systems in the world that need help and need guidance in these particular areas. We serve government entities like the VA, the military health system, or the Defense Health Agency. We also help subacute facilities. We help ambulatory care facilities, large physician practices, and even retail health organizations that are getting into the game. And the big players there: Walgreens, CVS,
Mm-hmm.
Walmart. They all need to understand the risk as they deliver care. And what we are helping them do is build that into every digital initiative that they have to think about security, to think about risk, to think about privacy. And that's really what we're advocating. And I'm seeing now even more opportunity, Jim, in the health and wellness area, virtual care that's really proliferated in the last 2 to 3 years because of the
Sure.
pandemic, and then hospital at home. So when you think about putting devices into your home to provide that care that's been traditionally provided in clinics or hospitals, that's where the ecosystem or the footprint of exposure has expanded to. And so those are the types of organizations that we are advising across the board.
It seems that there's kind of a transition going on, that the concern has shifted really from health data really to patients and the availability of care from ransom and supply chain attacks. So it seems like there's an evolution, kind of a constant evolution in the potential risk.
Unequivocally, and we talked about it a little bit before, but I think that's where the real concern is, and that's where when we talked about Congress, we talked about the executive branch getting involved. Is look, if you're a consumer, if you're a patient of a healthcare system, of a clinic, and you don't feel safe because those particular organizations are not motivated to protect your care, and if you're being treated by them, that's a massive problem. That's a massive issue. And so I think that's rightly where the focus is how are we protecting patient safety, because it's definitely exposed in the current state of cyber affairs and our current health sector posture.
Carter, it seems that cybersecurity is really not only about technology and process, and the vulnerability is often improperly trained staff. If somebody's sitting in an office somewhere and an email comes in and says, this is a funny cat video, and they click on it, that could cause big troubles. So obviously some type of education needs to occur in terms of best practice, what to do, and more importantly, maybe what not to do.
Oh, unequivocally, Jim. Education and awareness should never cease to be a top priority in any organization, anywhere, because that's your weakest link. You could do everything right, in an organization, but you just have to have that one person click on a link that gives that malicious actor access to the organization. And so that's what makes it so hard is you can be doing everything right. You can be following every best practice. You can have all the money in the world, but that one person just wants to, jump on that link, and they've probably been told not to. But the more awareness and education that you do, the better. And I can tell you that, as we advocate here in Washington, D.C., workforce incentives or subsidies or ideas around building a stronger cyber health workforce is at the top of the list. Absolutely. We recognize that there's not enough talent in this industry to meet the demands and the challenges that we're facing right now. And a lot of times other sectors that can pay more money, are taking the best and brightest from healthcare. And it's a problem. And I think that's, another major point of exposure that we have in this sector. And that's what, we're advocating for. And I think the rest of the industry should be doing is, how do we get more, individuals interested in cyber health?
That type of low-level attack that we just kind of mentioned, somebody clicking on a link, almost anybody can stage one of those attacks. They're very low level, doesn't require a lot of sophistication. To me, that's pretty scary. Before we totally run out of time, Carter, how can our listeners find out more about the services provided by First Health Advisory?
Well, certainly our website, firsthealthadvisory.com. We're on LinkedIn. We are doing all we can to bring awareness to this challenge, to this issue. And I think importantly, to get the message out beyond our smaller community of security practitioners and CIOs and IT professionals into the heads and the minds of CFOs and CEOs of health systems and the general public, Jim. If the general public were aware of the risks that they face from a cyber perspective, I think they'd be more concerned. And I don't want to scare everybody. I'm not a fear and uncertainty and doubt type of guy, but I think awareness at the general public level could put pressure on our policymakers to actually do something. We need incentives. There's probably an updated, regulatory approach needed when we think about HIPAA. That was primarily a privacy-based plan and it's 20 years old. It's not addressing the current cybersecurity needs of our sector today. So when you think about all those things, certainly there's a lot of work to be done. I am encouraged by what we're talking about here today, but the more aware the public is, I think the better off the chances are that we actually make some things happen here.
Well, I think in terms of education, I'd like to mention again that First Health Advisory is a lead sponsor of the upcoming CHIME online event titled State of Cybersecurity in Healthcare. It's a virtual summit on February the 8th. I'm certainly going to be in attendance, and attendees can register at the CHIME website, which is chimecentral.org, CHIME central.org. To our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Carter Groome of First Health Advisory. Carter, thanks for coming aboard today.
Jim, thank you so much for allowing me this platform and being able to amplify the message that we're wanting to convey.
Yep, thank you. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.